Sparhawk OD here. I had a couple of questions, or we usually have a lot of questions fairly commonly about contact lenses. Two questions mainly. One of them is, do I need a prescription, or do I need a valid or updated prescription to buy contact lenses? And the short answer is yes, you do. And so the second question to that usually is, what about the colored contact lenses that don't have a prescription in them, or in other words, they don't have any power in the lenses? They're just plain old lenses with colors on them. And in fact, yes, you do need a prescription to get those. There are some places that sell them inappropriately. You really do need a prescription to have those. And the reason is this, and I want to say this more than once in this video: you're placing a piece of plastic over the front of your eyes, and so we want to make sure that that piece of plastic is the most appropriate one for your particular eyes. So what do we do then? This is the second question. What do we do in a contact lens fitting? We'll start with the measurements that we've done in your regular eye exam, your eyeglass prescription, the curvature of your eyes. I will have looked at your eyes to make sure that they're nice and compatible with contact lenses. Make sure there's no eyelid problems or any cornea problems that would make it more difficult to, or make it impossible. I'll usually take that information and choose a lens based on your tear film and how you blink and everything like that. There are lots of different materials, so we'll try to optimize the best comfort that you have, that we can get. Next, we'll place a lens on your eyes. I'll usually do that and make sure the thing fits. We'll take a look at it, let it sit on your eyes for a few minutes, see if it's in the middle of your eyes or if it's kind of floating around, really loose. Make sure that everything is working like it should initially. You've got to learn how to put the lenses on, of course, and of course a lot of people know already. But after that, if everything looks good to begin with, I'll give you a little trial period. We'll send you home with contact lenses. You'll use them about a week and then come back. And some optometrists give you 2 weeks, or sometimes I'll do that as well. But in any case, we're giving them a trial period. We want to know if they stay comfortable, if they get really dry after a couple hours. All of these are things that we can't really tell when you initially put the contact lens on your eye. So, after this trial period, a week or 2 weeks or however long that your optometrist tells you to go, we'll take a look at the lens again to see if are there a lot of proteins or a lot of lipids stuck on that lens, or is it really too tight after it's been on your eyes a couple hours, or has it been just very uncomfortable and dry in your eyes, or do we need to change the power? These are all things we need to evaluate then after you've had them for that little trial period. Seems complicated, but like I said, we're putting a piece of plastic over your eye. We're covering it. This is not an environment that the eyes are used to, so we want to make sure that the particular lens is compatible with your particular eyes. Remember to take your contact lenses seriously. Change them when your optometrist or ophthalmologist told you to change them. Put fresh ones on more often. If you ever have, if there's ever a question, put them on more often rather than keeping them longer. And if you ever have a question, if you need to know anything about the eye exam, about the eyes, about my industry, please let me know and I'll try to address it with a similar video as this. Thanks.